I'm your student nurse and I'll be doing your discharge education today, so congratulations on the new baby. And who do you have here with you?
This is my roommate, Brett.
Alright, nice to meet you, Brett. So I just want to know quickly before I head to report, what are your guys' biggest concerns that I can make sure to address in the education?
Just the limitations I have with the surgery and how baby can get taken care of with those limitations.
Okay, sounds good. We'll definitely talk about that.
I just want to know how I can help out.
Alright, sounds good. So I'm going to head to report and then I'll be back to do your education.
Thank you.
The nurse will provide discharge teaching for a new mom that is 36 hours post C-section with her first baby. Her nursing diagnosis is that by providing education and resources to the new mom and her roommate about postpartum care, she is ensuring that mom and baby have the support and information needed to recover safely and maintain health. She has created an eco-map for this situation, and the education will cover the 3 domains of CFIM: cognitive, affective, and behavioral.
I'll be starting your discharge education now. So we're going to start off with nutrition. So for you, the new mom, just make sure you're avoiding gas-forming foods and drink lots of fluids and foods that are high in fiber to help prevent constipation.
Okay.
Alright, and so for exercise and activity restriction, just make sure you're only lifting things that weigh as much or less than baby. And for sexual activity, we kind of recommend that you don't have sex for the first 6 weeks. So we can talk more about it at your 6-week follow-up appointment. But if you are going to have sex, you can still get pregnant, so just make sure you're using the proper contraception. And so for hygiene and incision care, the most important thing is to make sure you keep your incision clean. And when you're going to wash it, you can have a shower and just let soapy water run down over it and pat it dry with a clean towel. Don't rub or scrub the incision because that could pull out the stitches, and just make sure you keep it covered during the day. So next we'll talk about pain relief. So things that can help with pain relief is rest or moving around or using a heating pad up against the incision. I see in your chart here that your doctor has recommended Advil or Tylenol for relieving pain as well. So just make sure you're only taking those at the recommended doses that it says on the bottle, because it could affect your breast milk. So next we'll talk about breastfeeding and breast care. So you're clear to breastfeed, so moms typically do it every 2 to 3 hours for a newborn baby. And to avoid breast discomfort and sore nipples, you can try different positions for breastfeeding and make sure that the baby is latched on properly. And I'll include a resource for a lactation consultant in your discharge notes, so if you need any extra help with that. Alright, so for infant care, it's recommended that baby sleeps on their back, and also that baby sleeps in the same room as mom for the first 6 months. And it's also important that you try to sleep when baby's sleeping. So roommate, that's when you can kind of help out just to make sure that mom is getting enough sleep, and that if baby's awake but mom's sleeping, maybe you can take care of the baby for a little bit. Make sure the crib you guys have is safe for a newborn, and it's important that baby gets tummy time every day, and this includes chest to chest. Okay, so last we'll just quickly cover post-op complications. So mom and roommate, these are things you can both watch out for. So they include fever, painful urination, heavier than normal menstrual bleeding with an odor, your incision being red, swollen, or bleeding, or severe abdominal pain. And I just want to quickly cover postpartum baby blues. So this might just be you can be sad or emotional for the first few days after you go home. This is super normal for moms to experience because it's due to your hormones shifting a lot. And it's only a cause for concern if it lasts a few weeks, then you might need to contact your physician. So that's it for the discharge teaching for today. So I know that this is a lot of information that I just gave you, so I have everything written down in more detail for you guys to take home with you, and I've also attached some resources for you guys to take with you, such as a support group for new moms. The Healthline number, the phone number is 811, which is a great number to call. It's 24-hour service if you guys have any questions that you need answered right away. And the website Healthy Parents, Healthy Children has a lot of information kind of about this transitional time that you guys are going through. So do you guys have any more questions or concerns for me before you go?
Nope, you've been really awesome.
Alright, sounds good. Good luck with the new baby.
Thanks.